Hi, good morning, Anthony. My name is Mihiraa. Let's start the warm-up session. What is your career goal after reaching your dream destination?
Right now, I do not have any clear management goals. I am very interested in learning about management and leadership and would be interested in any committees that I could participate in and learn. I have lots of ideas and would love to be in a brainstorming group, and I am very interested in the management dynamics of the organization. I feel that I need to join leadership groups to learn and meet new people.
What are the qualities that a nurse should possess?
Of course, a nurse should possess a variety of qualities. First of all, she should possess excellent communication skills, which help them not only to gather clinical data, but also to maintain an effective relationship with other team members. Secondly, problem-solving and critical thinking skills are essential for nurses to deal with emergencies and difficult situations. Other qualities such as punctuality, dedication, honesty, and competency are also pivotal for nurses.
What are the pieces of advice for the upcoming nurses?
As a nurse, I can give a bunch of advice to upcoming nurses. Firstly, I advise them to love their profession. If anyone loves their profession, they can carry out their responsibilities in an efficient manner without complaints. Apart from that, I advise them to be dedicated to their profession and maintain professional standards. These are essential because a nurse should abide by nursing ethics on any grounds. These are a few pieces of advice that I would like to give to future nurses.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Do you think nurses should attend continuous nursing education?
Yes, I do. The continuous nursing education program helps nurses to update themselves with the current practices in their profession. Moreover, nowadays, it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
Your preparation time is over. You can now start your role play.
Good afternoon, Mihiraa. My name is Anthony Santos, and I'm one of the nurses here. I'm here for a pre-discharge discussion before you go home after your shoulder dislocation. How are you feeling about heading home?
Good afternoon, Anthony. Honestly, I'm quite anxious. I'm a very active person, and I'm terrified my shoulder will just pop out again if I move the wrong way. I'm not really sure how careful I need to be, and the thought of managing everything with one arm is daunting.
Mihiraa, I want you to know that healing takes time, and that is perfectly okay. Your body is working gently to repair the soft tissues, and this process usually needs several weeks, not just a few days. You don't have to rush or be hard on yourself. The most loving thing you can do right now is to rest completely, because rest gives your body the quiet space it needs to rebuild and grow stronger. Avoiding any movements or activities that could re-injure the area is not about being afraid. It is about being kind and protective of yourself while you heal. Think of this as a soft season of patience, where each day of careful rest brings you closer to feeling whole again without setbacks. You are not falling behind. You are simply mending, and that is a quiet form of progress. Mihiraa, do you have any specific questions or concerns?
I'm mostly worried that if it comes out again, it'll keep happening, and I won't be able to play cricket or even go to the gym. Is there a way to know if it's healing the right way, or if I'm causing damage without realizing it?
That's a very common and very valid fear, and I can help clarify that. That's exactly what this sling and the swathe, that's the strap around your body, are for. It is very important for you to wear your immobilizer sling and swathe right now because it acts like a protective shield for your shoulder. While your ligaments are working hard to knit back together and heal, the sling keeps your arm in the safest possible position to prevent any accidental tugging or stretching. By keeping your shoulder still, the sling ensures that even involuntary movements while you sleep or walk don't disrupt the progress your body is making. Think of it as a helpful reminder for your muscles to stay relaxed and secure. When it comes to staying fresh, you can carefully remove the sling for a seated shower if your doctor has given you the go-ahead. While the sling is off, it is vital to support your injured arm directly in front of your body, almost as if the sling were still there, ensuring the shoulder itself does not move. Take this time to gently wash and dry the skin under your arm and around the sling area to prevent irritation. While you are tending to your personal care, please keep a close eye on your hand and fingers. If you notice any unusual swelling or a pins and needles numbness, it is important to let someone know right away so we can ensure your circulation is perfect. Does this all feel manageable?
Yes, the showering part was a big question mark. And what about the pain? It still throbs quite a bit.
Managing that pain is a priority, so let's talk about it. Mihiraa, you've been prescribed pain relief and anti-inflammatory medication. Please take it exactly as directed on the schedule, not just when the pain becomes unbearable. For the next few days, applying an ice pack to the front and side of your shoulder for 15 to 20 minutes at a time will be very effective in reducing that deep throb and swelling. Putting a small pillow or a rolled towel under your elbow and forearm when you're sitting or sleeping can also feel more supported. As a strategy, if your doctor has cleared it, gently moving your fingers, wrist, and even bending and straightening your elbow while it's supported inside the sling can promote circulation and reduce stiffness. And never underestimate a good distraction. A gripping movie, a series, or music can be a powerful way to shift your focus away from the pain. Is that clear enough, Mihiraa?
Yes, that's great. The distractions will be key. This sling is a bit awkward, though. What movements do I absolutely need to avoid so I don't mess this up?
It is essential to be very mindful of how you move your body during this recovery phase to ensure your shoulder heals correctly. Mihiraa, for the time being, you must strictly avoid reaching overhead or lifting your arm away from your side, as these actions can put unnecessary strain on the delicate tissue. It is also important not to use your injured arm to support any weight, such as pushing yourself up from a chair or carrying even light objects. These precautions are there to protect the surgical site or injury from being pulled apart before it is strong enough to hold. As you begin to return to your daily routine, The best approach is a slow and gradual transition. You should rely primarily on your unaffected arm for tasks like grooming, eating, or light typing. Always be cautious to avoid any sudden or jerky movements, especially in crowded spaces where someone might accidentally bump into you. While it can be tempting to jump back into your favorite activities, a full return to sports or heavy exercise should only happen after you have completed your entire rehabilitation program and received official clearance from your doctor. Staying patient now will ensure your shoulder regains its full strength and mobility for the long term. Okay, that's hard to hear, but I needed to hear it. I guess I'll be coming back here a few times then? Yes, absolutely, and this is non-negotiable for your long-term stability. Attending your scheduled follow-up appointments is a vital part of your journey back to full health. Mihiraa, these visits allow your medical team to closely monitor the stability of your joint and ensure that everything is staying perfectly aligned as it heals. During these checkups, your progress will be carefully assessed to determine exactly when you are ready to begin physiotherapy, which is the key to regaining your strength. Your healthcare provider will also perform a gentle range of motion check to see how well your shoulder is recovering its natural movement without being rushed or overstressed. Your first follow-up appointment is already scheduled to take place in just 1 to 2 weeks. This early meeting is incredibly important because it provides an opportunity to catch any potential issues early and to adjust your care plan based on how your body is responding. It is the perfect time to ask any questions you might have about your comfort or the next steps in your recovery. By staying consistent with these visits, you are giving your shoulder the best possible chance at a complete and successful recovery, ensuring you can eventually return to all the activities you love with total confidence. I feel like I have a plan instead of just a problem. Thank you so much. You are most welcome, Mihiraa. Wishing you a steady and comfortable recovery at home. Goodbye.